And I do have some slides because I think it can be helpful for some areas of focus, but then we're going to transition back to like group discussion at the end. And we'll stop recording so we can all kind of speak freely. Just checking everyone can see my slides all right. Holler if not. But welcome. This is a topic that I'm super excited to share a little bit about and to just recognize that May is Mental Health Awareness Month. And so we are at the start of the Mental Health Awareness Month, but I feel like mental health is always something that we should be aware of and an important part of our diabetes care, and also something we want to be prioritizing and in conversation about. So it's kind of like the inspiration behind doing the workshop now. I did want to share a little bit about my background for those of you whom I haven't connected with yet, just to kind of get a little bit about my perspective of where I'm sharing, kind of like the scope of practice that I'm in right now. And so first, here's me when I was diagnosed with type 1. It'll be 24 years in July. So that's like, this is like the only picture I think that exists of me from that time. And so yeah, so grew up my entire life with type 1. I really didn't think too much about it other than like it was just another thing I did. Like you brush your teeth in the morning, you check your blood. So it was very ingrained in me. And I think being diagnosed at the age of 3 was something that kind of helped that just be ingrained, that I didn't really ask a lot of questions about or really think much about until I was a little bit older and in college. And so I have on the screen here, I was born and raised and spent most of my life in Northwest Ohio, studied English and psychology, and then moved to Minnesota where I earned my master's degree in clinical counseling psych. And around that same time was exposed to mindfulness and yoga around 2017, 2018. Started my own practice, also sought out some certification programs, and also then was able to be connected with research labs. So I have some of the perspective of like personal practice, but then also sharing from the facilitator standpoint, which is a different way of learning and knowing and interacting with mind-body interventions, but then also the science perspective of that. Like how do we actually research these interventions? What does the science say about these coping strategies for our mental and physical health? So it's a super cool integration between those 3 ways of knowing and learning. And I'm currently here in North Carolina. I'm in Greenville, finishing up my 2nd year in my PhD for clinical health psychology, where it's a very specific program where I'm being trained to integrate mental, emotional, and social interventions in the context of medical care. And so being trained not only in clinical psychology, but then how do we bring those practices and those interventions to primary care settings, or working with patients who have chronic medical conditions or are experiencing acute medical crises. So kind of really cool to bring my like lived experience of type 1 diabetes into this program, and then also be learning from people in the field who are studying this from the clinical and research perspective. And then whenever I do my bio slide, I always have to have a picture of Leo. This is my puppy. I'm in my office on a Sunday because if I were home right now, he would be jumping all over me and all over the computer. And anyone I have a Zoom call with, I'm like constantly playing fetch. I don't know why that's the time he always needs to play, because then as soon as I log off, he like cozies up next to me and he goes right to sleep. So he's hanging out at the apartment. And then here's his sister, Lola, a very resilient beta fish that was gifted to me over a year ago, who is still with us. So I have to put Lola on the slide too. So feel free in the chat if you haven't already. I forgot to mention this. If you want to introduce yourself, share like how long you've had type 1 or your connection to type 1, what maybe brought you to the workshop, or what you might be more interested in learning about. I'll kind of read through those to help us with the discussion part at the end, or anything else you want to share. If you have a very resilient beta fish that you want to share about in the chat, feel free to do that too. And so while you might be sharing or building new connections, I did want to share the outline for the presentation today. Wanted to start with a mindfulness practice. I think that's important for grounding and to kind of bring us into our shared community space, even if it's virtual. And then really sharing a little bit about like kind of breaking some maybe myths or misunderstandings of like what is mental health? Like when I say mental health, what am I referring to? And then differentiating between like, okay, what's mental health versus like what is a psychological diagnosis or a psychological disorder? a little bit of information about mental health and diabetes care, why it's important, which we all know because we live it, but just kind of seeing some other areas that are maybe up and coming of focus and research, and then some common mental health concerns that people with diabetes might experience. So acknowledging too that like this work can span people's careers, and like what I'm sharing in the workshop is just a taste, just like a little bit of an intro. So if any of these topics are interesting to you or you would be in more conversation, let me know. I'm always happy to connect you with resources. I did want to leave you with some well-being strategies that are evidence-based, they're backed by science, and they are supportive for our mental well-being for anyone, regardless of what kind of physical health status they may have. And then this thing where I've been like so into giving people resources, and I'll talk a little bit more about it at the end, but I was like, I need a cool name for like my resource slide. So that's what Kelsey's coping cache is. But if you have ideas for other ways to name that, let me know. So just more resources for mental health and mindfulness. And I wanted to end with an affirmation activity. We'll see where we are with time. We might spend more time on that, or we might just move right into that community connection where I will stop the recording so that way we can all share with each other back in the Zoom room. All right, so if you are interested in a practice, we might do a couple minutes here where you are invited to kind of orient into your space. And so that might mean shifting around where you're sitting or standing or however you are. You might look away from your screen. You don't need to be facing it if you don't want to. And you might kind of check in with your body. So maybe here you notice how your body is supported and what it's supported by. Maybe noticing textures or different temperatures in the space. It might feel supportive to kind of lean your body or kind of shift around. That might change your awareness of the contact points between where you're sitting or standing. You wanted to use your eyes. You might notice different colors or shades of light in your space. Maybe you're kind of looking around, just noticing where you are. And if you'd like to keep your eyes open, you're welcome to find a place in which you can focus your eyes. Or if you'd prefer to close your eyes, you might start to lower your gaze out towards the tip of your nose, maybe softly closing your eyes all the way. When you are ready, perhaps shifting your attention into your breath. So here, starting to become aware of how the breath is already moving in your body without you having to tell it to. Now, as you're noticing your natural breathing rhythm, you might connect with what it feels like to breathe in your body. And so sometimes it can feel helpful to place a hand over your heart or a hand over your belly, or maybe the sides of your torso as one way to connect with this felt sense or this motion of your breath right here, right now. Other ways that you might connect with your natural breathing rhythm could be noticing the temperature of the air. Is it cool or warm as you inhale? Does it change or stay the same as you exhale? You're welcome to stay here with this awareness on your natural breathing rhythm, or maybe shift to a deeper breath rate. So maybe intentionally deepening your breath, if that feels useful for you right now. Perhaps being curious about what it's like to slow down your breathing, take that deeper breath, and how that feels in your body right now. We'll transition here to a brief loving kindness meditation. Knowing you can always kind of anchor back into your breathing if this is feeling supportive for you. Where you might repeat the following phrases either to yourself, in your mind, or out loud in your space. First, focusing on you. May I be healthy. May I be wise. May I give and receive kindness. May I live with ease. Maybe taking one more deeper breath in and deeper breath out. And now repeating the following phrases, focusing on all people with T1D. May all people with T1D be healthy. May all people with T1D be wise. May all people with T1D give and receive kindness. May all people with T1D live with ease. Maybe taking a deeper breath in and a deeper breath out. And our last place of focus could be on T1D healthcare providers or caregivers, whatever phrasing works for you. Where you might repeat the following phrases, focusing on healthcare providers. May all healthcare providers be healthy. May all healthcare providers be wise. May all healthcare providers give and receive kindness. May all healthcare providers live with ease. It'd be like taking a deeper breath in and a deeper breath out. Perhaps being with or noticing whatever might be coming up for you here, the close of our short loving kindness practice. Maybe noticing different sensations or feelings in your body, maybe emotions in your practice, thoughts that could be here for you. Just kind of noticing, no judgment, no expectations. And you're invited to close your practice in whatever way feels useful. Maybe that means opening your eyes or kind of looking around your space. You might shift around or kind of change the way in which your body is resting or where you're oriented. And eventually transitioning back to our virtual workshop. All right. Well, thanks all for engaging in that practice. We can debrief about it too in our connection time as well. So we're going to shift gears a little bit. So take all the time you need to kind of shift and reorient back to this kind of topic or idea of mental health. And I wanted to reiterate the point that we all have mental health. All people have mental health. And mental health broadly is referring to our thoughts. So it can be the types of thoughts we have, how often we have thoughts, content of those thoughts, things that we're thinking about. Mental health also refers to our behaviors, the things that we're doing or perhaps not doing. And also, what I think might come to mind more often when we're talking about mental health are feelings or emotions. And so broadly, talking about mental health and its role in diabetes care, we can see how all three of these really, really, really big topics are always going to be in our diabetes care. It's about how we're thinking, how we're approaching situations, what behaviors we're engaging in, or maybe what behaviors we're avoiding. And then kind of the emotional aspect of that. How does it make us feel? How do the thoughts maybe make us feel a certain way? How do our behaviors make us feel a certain way? And like the intersection between these three big areas. So mental health broadly, everybody has. But then talking a little bit more specific about psychological diagnoses, I thought this would be helpful just to give some information about. I tend to use the words or the phrase mental health condition, but you might have heard or might prefer to use the words psychological disorder or psychological diagnosis, mental health disorder, mental health diagnosis. It's all referring to the same thing. I just prefer to say condition. But know that there are over 300 diagnosable mental health conditions. And I have here's a book here. I don't know how well you can see this on the Zoom screen, but this is the book that mental health providers that I'm being trained on, that health providers use to be able to identify if someone, what they call, meets criteria or has certain symptoms that are related to a specific mental health condition or diagnosis. And so sometimes, we think about mental health, it's broad, everyone has mental health. Not everyone in their experience has a psychological disorder, but a lot of people will at some point in their life or have experienced that. And so just bringing some kind of awareness and appreciation there. And a diagnosis, it kind of differs, right? Like we can all experience anxiety, and there can be a lot of things that make us anxious related to type 1 diabetes. But then that feeling of anxiety is going to be different from a diagnosed condition of generalized anxiety disorder or another specific type of anxiety disorder. And so they have all these different kind of categories that have different descriptions of the symptoms that someone might be experiencing. But then it kind of meets this threshold of what would be considered a mental health condition when it's causing an individual a significant amount of distress in their daily life and or a significant amount of dysfunction in their daily life. So they're not able to kind of complete the things that they need to do or that they were used to doing before these symptoms got to this level or kind of pushed them into this distress level. And there are different, so all of that, I'm keeping this very broad, very vague because, there are over 300 mental health conditions. There's a lot of different types and symptoms vary, and also time periods vary, and like the level of distress and dysfunction can also be variable. But just having this appreciation of like, wow, like mental health can impact everybody to such a different extent. And then the level of distress and dysfunction is highly subjective to the individual, right? They're the ones who are kind of describing or telling someone like, here's how much distress I'm in, or here's how these symptoms are getting in the way of me doing my job or going to school or taking care of my kids or doing the things that I need to do in a daily basis. So there are a lot of different causes that are also going to be specific to the type of mental health condition. So very broadly, mental health diagnoses can be biologically based. So some have higher genetic components than others. They can also be based on kind of lived experiences that someone goes through in life. So exposure to trauma might make someone more likely to experience mental health symptoms afterwards, or environmental toxins that might kind of change the wiring of the genes that someone might be carrying. So it can be something that was biologically based or maybe kind of more like environmentally triggered. And then also notably, psychological diagnoses can occur at any point across the lifespan. Again, it'll vary, like the specific type of mental health condition we're talking about might be more likely, or someone might be at an increased risk of a particular diagnosis during a particular time frame. But mental health diagnoses span the entire lifespan. So children all the way up through older adults can and are impacted by mental health diagnoses. I know we'll have time for community connection at the end, but does anyone have any questions about like how to differentiate between like mental health broadly and then what is considered when there's a mental health diagnosis or condition? Okay, keep on going. And so this slide is kind of like, yes, maybe we've all experienced this to an extent. The role of mental health and diabetes care. So diabetes, like in and of itself, is a very emotionally and psychologically challenging condition to live with. Like our brains were not designed to be the pancreas. Those are two totally different organs in the body. And so or those of us who live with type 1 are tasked with this very challenging thing that like we're just trying to figure out how to do the best we can with the resources that are available, or kind of advancements in medicine and technology that are available, or being able to fix or resolve when those advancements aren't actually working how they're supposed to, right? And so just kind of recognizing that diabetes is emotionally, psychologically challenging. And it also, not only with this condition, is it like, okay, we're not supposed to be able to figure out how to, like our brains are not designed, the human mind was not designed to be able to figure out what's the balance between glucose in the body and insulin and all the other interactions with hormones that happen with type 1 diabetes. But then also like the incredible amount of awareness and awareness that we have to have as individuals with type 1 is very different than maybe other types of health conditions, or even someone without a chronic medical condition. We also have to have really effective and efficient problem-solving skills, which takes a lot of cognitive energy, takes a lot of brain power, takes a lot of energy to be able to plan effectively. Like, okay, I'm going on a trip this weekend. How much stuff do I need to bring? Should I pack extra? What happens if I run out of something? Who am I going to call in an emergency? Like, all of that is an extra added layer of kind of like awareness, heightened psychological stress that our brains are under. And so acknowledging that diabetes is hard as it is. Self-care, broadly speaking, like any human's ability to check in with how they're feeling mentally and emotionally, and then be able to employ effective coping strategies, that's difficult. That's hard for everyone. Um, and medical adherence, right? Like taking your medication as prescribed, going to the doctor when you were supposed to, getting a doctor's appointment, all of those, there's so many barriers in those kind of three domains. It's even harder to enact these self-care behaviors, enact medical adherence when someone is struggling with mental health symptoms and are struggling with mental health broadly. So it doesn't even have to be at the level of a diagnosed mental health condition. It can be someone just having a harder time with mental health in their daily life. And so that's where we see then diabetes is already hard, but then when we're having difficulty with maybe heightened stressors in our lives, or a lot of anxiety going on, or there are big experiences happening in life that might kind of shift or lead our mood to be kind of in a lower state. It feels harder to engage in daily activities, or meet others and have that social connection. All of those are additional barriers then to like effective diabetes care. There's a lot of evidence that supports the notion that stress that increases insulin resistance, and also weakens the immune system. So you may have heard that's pretty well known, of like, okay, the more stress that someone is under, it's going to be harder to bring your blood sugar back down into range. I don't know if anyone's ever experienced this, of where like, yeah, you got some big project going on or something different in your life, and it's like, I cannot get no matter how much, corrective dose I'm taking, or no matter how much exercise and water, I'm consuming, it's not budging. That's because that those stress hormones that are in our body kind of increase insulin resistance. And then maybe when that stressor's over, you might see that crash come down later, and it's like, oh, okay, well now my body's reacting to the insulin that it's supposed to be reacting to, but all at once later, and leads to that kind of increased stress response for having a lower blood sugar. So overall, stress impacts our body's insulin resistance, even when it's the synthetic insulin that we're putting into our bodies. And also weakens immune system. We already know people with type 1 already have that kind of lower immune system functioning, and so then higher stress levels or kind of lower mental health is also going to kind of amplify that weakened immune system. So the ADA, the American Diabetes Association, they have put some work out to say that integrated care leads to overall better health for multiple diabetes markers. So we think about like acute blood sugar, but then also like A1C, your chronic blood sugar over 3 months, but then also like psychologically, better well-being, better states of quality of life when someone has access to integrated care. So it's more than just like, okay, you gotta test your blood, you gotta do this stuff, because as we know, mental health includes those things about what we're thinking, what we're feeling, what we're doing, and how those can be barriers to how we're actually engaging in our medical routines. And so I have on this slide just some recognition of common mental health concerns that have been shown in I'm in academia, so I like the references, and I will have them at the end of the slide if anyone's interested in reading these or having access to the full papers. But just to like have, and I also think it brings validation too, of like, okay, maybe we've experienced some mental health concerns, or maybe we've experienced, or maybe we know someone close to us who has experienced mental health concerns, but then to like see it like documented and knowing that people are like working on strategies and finding ways to help with mental health kind of takes away that layer of like, okay, I'm not alone in this, right? And so on the left side of the screen, increased risk of actual diagnoses. So these are the mental health diagnoses for people who have type 1 diabetes specifically, are at a greater risk of experiencing anxiety, depression, or disordered eating at some point in the lifespan compared to when they've done kind of population-based studies with individuals who don't have type 1 diabetes. So it gets complex because mental health is complex and the interaction between physical and mental health is also complex. So in some of these studies, we have to remember like, okay, like then, but there are other factors that might increase someone's risk for having a certain type of mental health symptom, like a demographic factor, age, race, ethnicity, access to care, etc. But there has been enough that has been documented that shows this. So kind of interesting to think about like maybe having some awareness for ourselves, and maybe if we start to experience some feelings of anxiety or depression, or when it would be helpful to reach out for extra support, which I'll have resources for in a couple slides. On the right side of the screen, these are not diagnosed like mental health conditions, but they are what we call like constructs, but like this is just like a fancy way of saying like these are experiences that exist that have been documented that people are having more awareness of. And so something called diabetes distress, which is really interesting to think about, like the specific distress that people experience due to diabetes. And so with these, it's harder to find like rates of any of these specific concerns because it's not as easy as saying like, are you diagnosed with depression? Have you experienced a major depressive episode, etc. Because these aren't diagnosed conditions, but they are kind of like we can think of them as like surveys, right? Where people are kind of rating symptoms or rating how often they've experienced something like this. And really interesting work that's being done in like integrative settings showing that levels of diabetes distress are high, where people are distressed by their diabetes. And I'm like, yeah, of course, like I have diabetes distress about, so I can think about that in so many ways, and never really had any like healthcare provider ask me specifically about it. So there's a little bit of that disconnect. So I'm hoping we're moving towards more awareness of that, and just sharing that with you here to be like, wow, like if you've experienced some distress about diabetes, that's okay, and that's normal, and other people have felt it too. Fear of hypoglycemia is another one where someone might have kind of, we have to have some level of awareness, right? Low blood sugar is life-threatening, and we need to be aware of it, but it's kind of this intense fear of like then maybe where someone might be acting in certain ways, they're changing their behaviors that are going to prevent hypoglycemia, but that kind of level for hypoglycemia might kind of increase. So rather than actual low blood sugar, we'll say maybe 65, someone might start to get really nervous or really afraid at a level of 100, even though 100 we know is medically safe, but somebody is maybe having intense fears of like, well, I don't want my number to be lower because if we go lower than 100, then something bad might happen. So kind of that fear of having low blood sugar, but then avoiding two things that they might engage in that could drop their blood sugar to be lower, so they maybe might not exercise. And again, it's all on a spectrum, right? Of like, yeah, if we are running lower and we just ate a big meal, we have a lot of insulin on board, it might not be the safest idea to go on a run, but someone might be kind of like avoiding any type of physical activity, or not eating specific foods because they don't want to take insulin, or not taking their insulin at all. So you gotta kind of look at these of like, what is the concern, and then like how is the person reacting to it, and like is their reaction something that's helpful, or is it kind of creating this cycle of maybe then increased distress and dysfunction that we talked about in the first couple slides. The third one on the list is diabetes burnout. More recognition here is being aware of like how someone after any amount of time, so there's not a specific time, like you have to have diabetes for 20 years, like no, there's no time frame. And this can impact someone at any point of their life, of just feeling like there's so much that goes into diabetes care, but then not like just kind of avoiding it, kind of like going away from it. Like I can't test my blood one more time, or I can't look at this CGM anymore. I'm not even going to put the new CGM on. Like kind of taking, and it's different from taking a break that's going to be supportive for mental health, where it's like doing the activities that somebody needs to do to take care of themselves is something that's causing so much distress that they're totally avoiding it, because the thought of engaging in these medical self-care behaviors is too overwhelming. So it's kind of the way we think about diabetes burnout. And the last one on here is diabulimia. And so this is the idea of someone kind of restricting insulin to be able to lose weight. And so the word bulimia is a diagnosed eating disorder, type of eating disorder, but diabulimia is not an eating disorder, but it is something that's being recognized in the medical field of like, okay, well, somebody's then using, like they're not taking their insulin where they should, right? In a way that's not healthy and is with the intention to be able to lose weight rapidly. So all of these common and important to have an awareness of and thinking about how they might impact our own experience or those that we care for. So I think that's a good segue to like, okay, some practical well-being strategies too, of like a little taste of, yeah, mental health is real in diabetes care, and we all are going to have unique stressors and ways in which it impacts us. But then how can we generally, so not diabetes specific, but generally support our mental health? And these are all research supported, and they're also going to be specific for each person. So I like to have a wide variety, because it's like different things are going to resonate with us, and also at different times and phases of life too, and with other things that we have going on. So I wanted to have a little bit of a variety. This is also not a comprehensive list, so when we're in the community connection piece or in the chat, if anyone wants to throw in like other things that they find really supportive for well-being, feel free, you're welcome to. I won't like read all of these to you. You can just like check them on the screen or take a screenshot of it if you'd like. But thinking about, like from more professional standpoints, like, psychoeducation, therapy, counseling, medication, I do want to like voice that, like those can be helpful for people. And also sometimes people don't want to use those supports. So it's like, there's more than just therapy, and also like at one point, is that helpful or harmful for someone? But then these are the other ones are more things that you can integrate in your daily life too. So mind body practices, meditation here at the sangha, we all know that pretty well. But then even things like social support and how we might be connecting with others, and how our social interactions might be helpful for mental health, and how sometimes our social interactions might be actually very harmful for mental health. So just bringing some awareness to those kinds of relationships or exposures you might have in life. Um, and yeah, just all kinds of other things on here that, again, this isn't in replacement of therapy for someone with a diagnosed mental health condition. These are things in which we can be doing to kind of boost ourselves, to kind of keep our mental health in a place that feels okay, that you might already be doing some of these things and not even have really realized it. But sometimes we realize it maybe when we stop doing them or don't have the time in the day to fit one of these things in, and we're like, man, like something feels different. And you might be kind of noticing those effects on from your own little experiment. And then I did want to add a slide here of like, okay, at what point is it helpful to maybe seek professional mental health support from a psychologist or a social worker, licensed professional counselor, like mental health providers. There are lots of different types of mental health providers. And so kind of like therapy, or we can also call this counseling. There are different styles, different approaches. Happy to kind of answer any questions about that later. But it's like if your usual coping is not feeling adequate, if it's not useful for you anymore, if it's not feeling healthy or adaptive, or if you don't even know where to start. So and you don't need to like meet all these points. These are just some ideas of like when might it be helpful to kind of maybe seek out some professional support. We go back to that piece about experiencing significant distress and dysfunction. So if your mental health is creating so many barriers in your life where you're not performing as well as you used to at work, or as well as you could at work or school, or you're noticing a lot of interpersonal difficulties with people in your life, that might be a time when it can be helpful to seek out professional support. Or even if you just want some extra, like a little extra booster. So there's maybe like a myth that like therapy is only for people who have significant mental health concerns, and anyone can go to therapy and counseling. Some people I've even had like in my training experience, I've worked with a wide range of patients, and sometimes people come in as just like kind of like a monthly check-in, monthly kind of booster session, if that's something that resonates with you, if it's something that feels like it would be helpful in your kind of healthcare, your range of healthcare options. And then if you are, I wanted to have this here. I also have it on the resource slide. For mental health crises, for you or someone you might know, if you text 988 on your phone, that is a free access to confidential support with trained crisis counselors. So something that you can consider for yourself or for others that you might know in your life.
You can call that number too.
Yeah.
You can talk directly to them.
Yes. And yes, thank you for mentioning that. Text or call, whatever feels more useful for you. Feel free to take a picture of this, or this is being recorded too, so you can check it out on YouTube. This QR code should take you. This is where I was talking at the start of the presentation of like, I love to give resources in any presentation I do. And I tend to do a lot of mindfulness yoga, trauma sensitive yoga, PTSD, trauma care presentations, but then have been kind of moving a little bit more into diabetes, mental health, and some other general mental health presentations. And I was like, why do I have different QR codes for like each thing I'm doing? I just decided to put everything on one document. So this should take you to a Google Doc. I tested it earlier, but if for some reason you're not having access, let me know. Where I like the first page, actually, let me show you. The first page shows this, what did you call this? Table of contents, where you can like click on the thing and then it'll take you in the doc where it is. It's got different websites, books, apps, some things. Like I said, I do a lot of work with mindfulness and yoga, so you'll see a lot more resources there. But I plan to just like keep adding to this over time. I don't the only connection I have to anything that's on this list is my book is linked on here in the diabetes and mindfulness piece. But I also have some crisis resources here and other links that might be helpful for you to know about or share with others. But yeah, just a very broad range of all kinds of stuff. So if you look at this today and then you look at it like in a few weeks, it might look different. I will be adding to this over time. That's kind of my that's kind of my intention. So that way I don't have multiple QR codes going. Okay, so that, and I can also pop the link in the chat too. References, if you want to take a picture, screenshot of this, if you want to read more about any of the papers that I cited on the first few slides, specifically with diabetes and mental health. And then I wanted to close with an affirmation activity. And so this is something that I think affirmations can be helpful, especially when we're thinking about mental health or just challenges, just daily diabetes challenges. Or an affirmation, it can kind of be like a supportive phrase, maybe a mantra if that word resonates with you. It could be a specific word, it can be an intention, it can be a value, something that you can kind of anchor in with and return to in moments of challenge. And you can take this however you want, where like whatever type of, if you want to make it for a specific challenge, if you want to make it for like a broad challenge, your choice. Where you can also relate this to mental health, type 1 diabetes, the intersection between them, your mindfulness meditation practice, or really any kind of area in life. And I kind of encourage you to think of a place in which you can keep your affirmation. And so this word or phrase, or maybe you already have a word or phrase that is supportive to you in moments of struggle, where you might type it on your phone, maybe you write it on a piece of paper, kind of display it on your fridge or on your mirror. Some people kind of like to write on their mirrors, make it into actual art, like whatever you want to do with it. Maybe even if it's a common phrase or a word, you might be able to find already like a little infographic like on Google Images with it. So kind of use this like somewhere where you can have this like tangible representation of your affirmation. So that way in times of kind of maybe like higher distress or heightened distress, you can like look at it and remind yourself of there it is. And so if you wanted to, we might have a moment or two where you can kind of think to yourself of an affirmation that feels supportive. Also, we'll open it up when we move to the community space if anyone wants to share their affirmation. I have these are just like little general ones I found on Canva when I was making the slides, but then these are also some examples written here. So it could be something like, I'm not alone in this, right? So you're not alone in type 1 diabetes, even though that doesn't, it might feel isolating. It might feel like you're the only one who's ever experienced something like this. And I don't want to take away from that feeling, and at the same time kind of holding this collective experience of there are so many other people with type 1, so many other people have experienced hard moments here. Again, not to take away that distress, not to diminish it in any way, but just to remember you are not alone. We can also put that in the mental health sector as well. Something that this would be mine if I had to share mine with the group. Be observe, not absorb. That's something that I've kind of picked up this last year, like things that I can observe and be curious and open to without maybe letting personally impact me Small steps matter, mental health, diabetes care. We can't do everything perfect all the time, but what are some smaller things or things that might feel small or seem small? What are some things that you can do in this moment that are kind of moving you towards your goals or your health goals? And then one that might be related a little bit more to mindfulness, be here now, or any sort of kind of present moment reminder. So those are some examples for you, but I encourage you to kind of think of your own, unless one of these resonates with you as well. And as you're thinking, I wanted to just pop this on the screen. Thanks for your attention today and for being in community. Here's my email. I'm always happy to reply to any questions. If you're watching on the recording, feel free to email me if you want to chat. So I'll stop the recording here so that way we can transition to community time.